Appreciate everybody being here today. Next slide, please. My name is Gene Kimball. I'm the Deputy Public Affairs Officer here at the Dole VA, and I'm going to be your moderator for today's town hall. We're going to provide updates today on various VA programs and services, followed by fielding questions, but let's review some housekeeping notes first. Next slide, please. Please be aware that today's session is being recorded, so others may view it at their convenience. If you have questions at any point during our briefing, we encourage you to submit it via the chat window at your earliest opportunity. Also, at the end of the presentation, we will invite you as guests to unmute your mics and ask questions if you feel you have questions that haven't been answered during the presentations. When asking questions or making comments, please refrain from sharing personal information during the session, whether it be your personal information or that of a comrade or a friend. We do want you to be aware that there was a link to this town hall and it's been shared publicly, meaning that anyone could be logged in and watching us. So with that, I'd like to get going. Next slide, please. Mr. Michael Payne, our Medical Center Director, joined us in July of 23. Since then, he's devoted himself to furthering the mission of providing world-class care to the veterans that we serve. He's here this morning to address a few hot topics with you. Sir?
Okay, good morning, and thank you, Mr. Kimball. All right, let's go to the next slide, please. All right, so as Mr. Kimball alluded, I will go through a few updates regarding our facility status and some interest of items of concern, potentially. And so the first slide just really speaks to our general workforce update. And as you see on the screen, this focuses on our operations since the new administration took over. And so as of today, we have not had any zero diversions and or zero curtailments. And that is current actually as of the 16th, which is today. And this was updated a few days ago. And so what that means is that there have been no adverse impacts to veteran care. There have been no adverse impacts to the quality of that veteran care, and there have been no adverse outcomes as a result of any decisions that have been made by the administration's changes in executive orders and just general workforce restructuring plans, et cetera. The second bullet refers to the update on our deferred resignation program, and that is just a program that all federal agencies have been offered. It started back in late January, early February for the first round of it. And this bullet indicates the specificity associated with the first round. There is currently a DRP, what we're calling 2.0, which is also the second round that was recently offered again, and that is effective 7 April through 30 April. So we're in the middle of that right now as we speak. So staff that have expressed interest and are eligible to apply for that program are indicating their interest, and ultimately those data will be rolled up over the next several weeks, and we hope to have some input back by early to mid-May on the impacts associated with that program as far as staff that have expressed interest at our healthcare system. And so the first deferred resignation program, we had 9 of our VA staff that ultimately enrolled in that program and accepted it and were approved for it. We actually had a total of 22 additional staff that applied for the program that were deemed not eligible because they were in occupations that were deemed mission essential to our operations throughout the healthcare system. And the VA, the larger VA, has indicated a list of occupations that are exempt from the hiring freeze, that are exempt from certain programs as well, like direct care facing clinical positions, your doctors, nurses, tech positions, some administrative functions as well. And so to date, we have not had any of our probationary staff that were terminated as a result of the executive orders surrounding federal employee terminations and during probationary status. And so we did indicate 2 employees that were potentially going to be impacted by that, but those issues have since been remedied, and those employees were identified in error, bringing that total number to 0. And so there's been no adverse impact to our healthcare system as a result of that. We've also acknowledged that there's an ongoing hiring freeze, and that actually is not new, effective this year. We actually have been working sort of in that environment overall, and I'll talk about that a little bit more in the second bullet on staffing and workforce. But we at the Dole here in Wichita have been operating in sort of a strategic hiring mode for the past year and a half, where we've been hiring only those positions that have been deemed mission essential and mission critical to our overall operations. And so that hiring freeze exemption list that came out from the VA central office lists hundreds of occupations that have been exempt from the hiring freeze for the VA. And so we expect that there will be another round of positions that will be included in that exemption for round 3. But to date, we do not have that list approved yet. So we're operating out of phase 1 and the phase 2 occupations that have been included in the exemptions. With regard to staffing and workforce strategy for this year, those data are as indicated on the screen as well. We've been working in this environment, as I've indicated earlier, for really the past year and a half or the better part of 2 years. So it's really been part of our organizational culture and our organizational design to identify occupations within our healthcare system that are not as mission essential, and sort of redirecting program assets when necessary. And so we've started that centralization of some support staff responsibilities, those non-direct facing clinical care positions. And we've also started looking at some even clinical occupations that have been deemed essential, but may be more efficient in other program areas or may in other areas across our healthcare system to better serve you, our veterans, and to provide high quality care and high quality outcomes to our veterans. And so that's something that we'll continue to do, and that is not a new thing for us. Same for succession planning. With regard to succession planning, as you've likely heard before, all organizations do it. It's part of our routine workforce plan every year. We also meet as an executive leadership team each year, and we hold a strategic planning conference or an offsite where all of our leaders at our healthcare system get together and plan out our strategies for that year and identify unmet needs. We identify barriers to care. We identify opportunities for improvement, putting the voice of the veteran at the center of what we do, along with their caregivers, family members, and survivors. And so that's always what we'll continue to do. And so that is incumbent upon us all as leaders, not just the executive leadership team, but the department level leadership, section level leadership, program level leaders, all the way down to the frontline leaders, and including the frontline staff in that planning as well. With regard to the third bullet, systems redesign and continuous process improvement, that is also an initiative that has been helping us as we work towards our succession planning goals and centralization of some support responsibilities in areas where we may not be as efficient as we could be. So we're continuing to look at that and look at ways that that team can help us better align our resources to better meet the needs of our veterans, and then still balancing a safe environment for our staff and our visitors as well. Okay, next slide, please. Okay, so you likely probably also heard that whether it's in the media or social media or wherever it is that you receive your information from, the federal government was mandated through executive orders to return back to work. So that has not been a big change for us at our healthcare system. As you all know, even through the pandemic, most healthcare systems still showed up to work each day. We did not have the luxury to take any time off or to work from home for some of those positions, especially those direct clinical care facing positions and forward facing positions that provide direct care to veterans and then support staffs in some cases. And so that is an extension of what we've all been doing as well. We do have some staff that were under telework agreements or virtual or hybrid work agreements by virtue of how the position that they applied for and ultimately was accepted in was announced. And so those employees have also been brought back into the office. And if they haven't been, they will be brought back in the next week or so. We have other staff as well that are not part of our organization that are also returning to our offices because they live within a specific radius of our healthcare system. And the policy states that we should accommodate them and provide office space for them as we are able. And so we have a project team that's working diligently across our healthcare system to identify those opportunities for space in a variety of areas, both at our community-based outpatient clinics and our main campus here in Wichita. We've also partnered with the VBA out at the Ruffin building down the road, and they are also helping us as we start to build out more office space and seek more office space for unmet needs that we might have. So there's some business staff that are being placed. There's some staff that are from areas outside of either Vision 15 or the Wichita healthcare system that we're also attempting to house as we have that space available. So this really is an ongoing effort. This is a whole holistic approach to filling those office spaces as we are able. And we look forward to continuing to keep those communication lines open with you for that. This has obviously created some parking challenges. As you likely know, our parking spaces have been limited even before we got into the executive order bringing everybody back into the offices. And so we're still challenged in that regard, but we have worked through several options to mitigate some of those parking challenges. We're in the middle of looking at rideshare options with some of our local community partners. We're also in the middle of a parking pavement project on our campus where some of those gravel lots will be turned into parking lots, at least temporarily, until they're paved, and they'll also be paved over the next year as well. We're also looking at leasing some parking spaces from other areas in the community, such as the Town East Mall and other places that may be options for us that we can get staff to park there and ultimately bus them or transport them to our main campus. And this is in an attempt to free up space for you, for our veterans, for our caregivers, their families, and their survivors. And so we acknowledge that we have certainly a lot of room for improvement in this, and we apologize for any inconvenience that this has created for you and your families. We're doing our best to try to bring this together very quickly and safely, and to also communicate that as effectively as we can as well. So we'll continue to keep you updated, but we appreciate your patience. And we're also asking our staff to not park as close to the buildings so that our veterans, especially those with mobility challenges, can get in and out of the building safely, with support of others, and that we're being mindful of having our police service doing more routine patrols, and they'll be issuing warnings and citations eventually for staff that are not compliant with that. Also, the last bullet speaks to contracts. And so you've likely heard through the media or social media or wherever it is that you get your news outlets from. We are also in the midst of looking through a whole host of contracts across every single hospital system in the VA to determine whether or not there's still a need for it, and that it's providing value to the veteran. And so we are in the middle of that as well. We'll continue to be in the middle of that along with the Secretary's office, the Doge group as well, and those individuals that are helping the VA sort through some of those contracts that may be identified for either potential clarification, elimination, rewriting, etc. But to date, our healthcare system has not had any adverse impacts as a result of any of those contract terminations that have been happening nationally and locally. We have not had any adverse impacts as well. So we'll continue to keep you all updated if that changes. And we also have to report those things up through our DC office via our regional office and that group as well, if there's any curtailments or if there's any adverse impacts to veteran care or quality of that care. And so you have our commitment that that will continue to be a priority, and you certainly have my commitment that I'll continue to advocate and elevate issues and concerns that might come to me outside of what we're briefing now. Next slide, please. Okay, so
I
that's
believe you're
it.
done.
That's it. I will stand by for any questions, comments, or concerns that any of you have. Of course, you could also always reach out to me at my personal line. You can email me. We have a lot of speak to the director boxes that are all throughout our campus and our C box. We also have a SharePoint page. We have Facebook page. We have all sorts of different outlets that you can reach us, and you can get information specifically to me. If you have something specifically for me or my executive leadership team, we are here to serve you. And if that is not being consistent with your experience, we need to know about it. So thank you all for your service. Thank you for what you do. And thank you for being a good partner with us in these times of transition. All right, back to you, Mr. Kimball.
Thank you, Mr. Payne. We are so glad that you're here with us. And I'd like everyone out listening to know that Mr. Payne has been outstanding when it comes to transparency of issues with staff and with our public and our veterans. We hold weekly meetings that are open to all staff. We call them chat and choose. He has been an outstanding advocate for the veterans first and foremost, but also for our staff. And it's been very welcomed here at the Dole VA. So with that, Leah Hutchison is one of our chiropractors, and she's a certified battlefield acupuncture trainer here at Dole VA. We had some really good comments recently from some of our veterans about this service, and so we wanted to have Dr. Hutchison provide some additional information for you. Dr. Hutchison?
Well, thank you for allowing me to be here and present this today, and thank you for that introduction. So I'd like to go over a quick overview of what battlefield acupuncture is. It was first brought into the active duty DoD side by a colonel named Dr. Richard Niemzow, and he was an Air Force physician, and this was in 2001. Since that time, it has been brought into VA as well, and we've seen this as a growing trend, which is wonderful. So the key features of this acupuncture is that it's a protocol with basis in traditional Chinese medicine that has now been packaged in a way that we can repeat it and teach it to others. So the location of the points is critical. And these are inserting small semi-permanent needles into specific points along the outer ear. The purpose is that it's used for any type of acute or chronic pain. The veteran will also see immediate pain relief. And the durability is that these needles stay in place in the ear for up to 3 days. While they're in the ear, they can continue to be stimulated to provide further relief. And the value here is that it's a non-pharmacologic therapy, meaning we're not doing any type of prescriptions associated with this. It's an alternative or something to add to the normal pain care management. And pictured here is a veteran receiving this treatment. This next slide shows the status of acupuncture in the VA from a recent call. So we can see that BFA really started to pick up during COVID. We started tracking some of the visits from 2020 and 2021, and it's grown quite a bit just within the last year, almost by 30%. It's important to note that nationwide, the acupuncture available in the VA may be limited. There's only 134 licensed acupuncturists. Now, with the BFA protocol, it can be taught and performed to various other providers. So this can include a registered nurse, a nurse practitioner, physicians, chiropractors, and a few others. And so to date, we now have trained over 10,000 BFA providers. So what that means for veterans is that we've really increased the access for this service to be brought into the VA. And it can be done by multiple different providers added into their scope of practice. And we've really taken that at Dole VA, and it's grown quite a bit since we started performing this here. We'll see on the next slide some summary of some questions that you may be thinking. So first of all, how does putting needles in my ear help my knee pain? And that's a valid question. So I think it's important to understand that within acupuncture, there are several microsystems that are used to treat the greater distal portions of the body. And those microsystems can be located on the ears, of course, the hands, scalp, or feet, as you see with reflexology. This is really key to the protocol because these areas are easily accessible. We don't have to take off any clothing or lay down on a table. It can be easily accessible for the provider. Another question might be, does it hurt? And that varies from patient to patient. Some may have a little bit of pain and some may have no pain at all. The adverse effects with this are very little, so the risk is hardly at all. The veterans may just experience a little bit of pain. So having a low risk therapy option is also a big value for the VA. Another question, does this work? And the answer is yes. There's been quite a bit of research published since this has come out, since it's a relatively new therapy option. There was a patient feedback for the effectiveness of auricular therapy that was published, and this is the experience of over 11,000 veterans taken from multiple VAs that are participating in battlefield acupuncture. What they found was that almost 80% of veterans reported an immediate decrease in their pain relief, and that's an average of 2.3 points reduction on the DVPRS pain scale. And that's the Defense and Veteran Pain Rating Scale. That's the scale that we see in all the doctor's offices where there's a very smiley face with 0 pain, and the face gets grumpier as we get to 10 out of 10 pain, which is as bad as it gets, really. Nothing else matters. And so on that scale, essentially, if a veteran comes in with a 6 out of 10 pain score, they'll on average leave the office at about a 4 out of 10. So who's a good candidate for battlefield acupuncture? There are a few contraindications, mainly if there's any lesions or open sores on the ear. Pregnant veterans may want to abstain from this. But really, the contraindications are pretty rare. Being on an anticoagulant or a blood thinner may have extra bleeding on the ear, but it's not an absolute contraindication. We have other mechanisms instead of the needles that could be used with this protocol, to include a little tack that could be placed on the ear, or even an ear seed, which wouldn't puncture the skin at all. So we have options for those veterans who may have a contraindication. So it's important to discuss a referral to the BFA clinic with a primary care provider. We'll have one last slide. So in summary, the battlefield acupuncture is very easy to perform. It's fast, effective, and incredibly safe. We have group BFA clinics that are a few days a week that can see multiple veterans at one time, or it can be done one-on-one in your PAC team if your nurse or your doctor is certified. It is a referral-based clinic, and it's very versatile across a wide variety of pain conditions. As we learned, you can treat any type of pain within the body from some of these points in the ear. And also, veterans have reported improvements with their sleep, mood, and overall mobility after receiving this treatment. And finally, it's a holistic approach. Again, it's a non-pharm option that has fairly good results in treating pain. So I'll stick around at the end if there's any questions about battlefield acupuncture.
Thanks, Dr. Hutchison. Real quick, there was a question on the chat. I'm going to ask you because I think you can answer it pretty quickly. The person is asking that his ears are cauliflowered from grappling, judo, and jujitsu, and so will it work on his ears with cauliflower?
That's a very good question. I think we'd have to take a look at the ear first to see and make a clinical decision. And then again, we have some of those options. If a needle is not going to be appropriate, we could do a little seed tack, a seed or a tack, and you can get the same benefits. I think also it's important to note that acupressure is very valuable in this. We can also show you how to just stimulate your own ear by using pressure points where we don't have to put anything in the ear at all. So I wouldn't absolutely say no to that one.
Okay. Well, thank you very much. Thanks for your presentation today. Sounds like an interesting and different type of modality for pain relief. So appreciate that. There are more I'm sorry. There are more changes taking place here at the VA than just those that Mr. Payne discussed earlier. Charles McFadden, the Transportation and Travel Pay Chief, is here to share an update. Charles?
Well, good morning. I hope everyone is having a good day today. Wanted to kind of preface our travel pay department before we get going. As you know, travel pay is always changing and constantly evolving. But I can tell you that your travel pay department here at Robert J. Dole VA, we are constantly ranked at the top in our VISN, and then we are also constantly ranked in the top in the nation. When we have folks from the San Diego VA reaching out to get our best practices, we know we're doing something right here in Wichita. So real quickly, and I'm sure that if you file travel pay, you may have already seen these signs that we have up. There's a new travel pay form that just came out on February the 14th. And so we've tried to get these forms out around the hospital, and here on the slide, there are also some QR codes to where you can go on and you can download the form yourself, or better yet, which we would prefer, everyone to file their claim electronically. That is the key word, filing your claim electronically. Most of the time, your funds will be deposited into your account within 5 days versus a paper claim that can take about, I think we're running about 12 days right now. So please, 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 if you're able to, file your claim electronically. Next slide, please. All right, so the OGC recently made some updates to advanced payments. What are advanced payments, you ask? Advanced payments are when we pay in advance for an air flight going to the Mayo Clinic for a care in the community appointment and procedures like that. So according to the OGC's ruling, and this came out last month, I believe as well, we are not able to pay in advance for air flights. So if you have a care in the community appointment coming up, going to the Mayo Clinic, or anywhere outside of our area that requires a flight, we are not able to pay for that flight in advance anymore. Now, with that said, every situation is different and every veteran situation is different. We understand that. So, we look at those things when we're making that determination. And now, the one thing that it does not affect is our transplant services. Those will continue on just as they have before. But just kind of, keep that in mind if you're needing to schedule something with care in the community. It might be something to kind of keep in the back of your mind that we won't be able to pay for the flight in advance. So, and I'm sure we'll probably have some questions about that afterwards. So, next slide, please. The other change in our travel pay comes with meals and lodging. We've had in place prior, the top three things there as far as hotels, meals, and lodging, they must be approved ahead of time before the travel takes place. Drive time must be over 3 hours, and then you also must be eligible for travel pay. Now, keep in mind, as it states down there below, that other things can, factor into this, like the weather. Say you have an early surgery in the morning where you have to be here at 7 in the morning and you might live a little bit farther away. Again, we look at all of those things, but the biggest thing that I want everyone to get on this is that the actual cost for meals and lodging or both cannot exceed 50% of the amount allowed by GSA rates. GSA rates are determined by zip codes as far as the state that you're in. For travel pay, we always look at the zip code for where the appointment is at, not where you stay at. So for example, the GSA rate, I believe for here in Wichita around the Dole VA is $110. We are only able to reimburse up to half of that. And that is a CFR, and we have the CFR located there. So that is a really big change for us when it comes to meals and lodging. But just, keep in mind that we're flexible to a point, that we can be, and we will definitely take a look again at every situation and everybody's circumstances. And again, there we do have the QR code for you to file your claim electronically. So that we're really trying to push that home. So we can answer some more questions about that later on as well. So next slide, please. All right, so the API check-in for clinics. If you receive a text message about checking in for your appointments, as we all do, as veterans, when you have an appointment coming up, you'll get text alert after, you might get something in the mail about your appointment, but it seems like you're constantly getting text messages. Well, for certain clinics, we do have that turned on to where you can request your travel pay for that. I did find out before this call, there's about 50 clinics in our hospital that participate in this. But the great news is that we just found out that we can add more clinics to that if we want to, which I definitely think that we want to, since we're, really wanting to get everything electronic. So that's definitely something that we're going to be looking at in the next few days, next week or so, about adding more clinics to the online check-in. But since this was a pilot program, they limited it to 50 clinics, and so we're going to expand that out. So there's that. Next slide, please. And this is our contact information for our Veterans Transportation Service and our Travel Pay Center. So if you have any questions, you can give us a call. There's also online access to file your claim. We also do have an email group. So if you have any questions or you're wanting us to send you a form, through email for travel pay, we can do that as well. You can also send your care in the community documentation showing that you attended your appointment through that email. And then we also have a fax line too, if you would like to do that. So, and of course, one more time, there is our QR code again. So please, if you can, file your claim electronically. We would much rather get you paid sooner than later for your travel pay. And that is all I have, sir.
Thanks, Charles. Real quick, there was one question. When will you pay road tolls if the map on your navigation system of your vehicle takes you along those roads?
That is a good question, and we can reimburse for tolls. We just need documentation showing that you paid for those tolls. I know that now everything is electronic, but if you can get us a copy of, your KTAX statement or something like that, we can always add that to your claim. Even if you don't have it on the day of your appointment, we can always go back and add that onto your claim later on.
Perfect. Thanks, Charles. Next up is Melvin Bingham, Chief of our Prosthetics Service here. And he is here to discuss a change in the process of having your powered mobility devices repaired. Mr. Bingham?
Thanks, Gene.
Yep.
My name is Melvin Bingham. I'm the Chief of Prosthetics, and I do want to discuss with you today some changes in powered mobility repair. Earlier this month, I distributed about 1,000 flyers throughout the facility. The flyer is the one that you see on the screen in front of you. And really the takeaway from today is just the information that you need to contact for a repair on your primary powered mobility device. There's two numbers I would like you to take away, and that the first one is the number to the national contracted vendor, which is Scootaround, and that number is 1-888-583-3699. HealtheVets or 1-888-583-8387. I know it says over here 583. It did say a different number, but it is 583-8387 is the last of that. Okay. If you want a flyer like the one that is here, you can contact Prosthetics and we can send you one. Also, I think they posted it in the chat, or it'll be available here, and it's also available through our mobility clinic or through Prosthetics. We have a bunch here in the main facility, and we can send those to the C-Box as well on request. Okay, next slide, please. The main things that I want to discuss about the contract with Scootaround. It is a national contract through our Denver Acquisition Logistics Center. So it is brand new. It does require a call to Scootaround. You do not have to contact the VA if your scooter or your powered mobility device, your wheelchair needs repaired. We are only going to repair the primary device that you have on your record, okay? But no consult to the VA is needed unless Scootaround cannot identify your primary device on your record. If that's the case, they'll reach out to us for assistance with that, and then we contact Scootaround back, either accepting or denying whether or not the device is on the record. So there's a lot of information that transpires between Scootaround and Prosthetics behind the scenes for you. But all you have to do is contact Scootaround directly and let them know that you need a repair on your primary mobility device. As this contract ramps up, there are more vendors who will become available, and the process will get easier. Right now, there's some limited coverage of Scootaround in the extremities of our area. But as it becomes a more fully blown contract, there will be other subcontractors that will be able to come out to your local area for the repair. If Prosthetics is contacted first, if you, like we always have been, our first question is going to be to ask you if you've made a call to Scootaround. If you have made a call to Scootaround first and they tell you to contact us, we will already have some information in our records from that, but we'll be happy to assist with coordinating the repairs that Scootaround cannot make. Okay. Our contract only covers the repairs of your current primary powered mobility device. It does not cover the lift. It doesn't cover the vehicle. It doesn't cover any accessories. It's just the primary mobility device that covers. If there are any questions that you have on that, feel free to reach out to Prosthetics here at the VA. Our extension at the VA is 53626. And I'll be happy to answer any questions that you have. So next slide, I think that's it.
I think you're done, Mel.
All right.
So
all right. Thank you. Yeah.
You bet. Thanks for that presentation. There were a couple questions. We're going to have him contact you directly with that question from the chat, or if you get into the chat, you might be able to answer that question for him in the chat so that we can keep moving forward. So thanks. Dole VA does a great job of being innovative in many processes, looking for ways to improve communication, processes, efficiency issues. Lauren Riso, our primary care RN, has been working on a pilot project to improve care for our veterans. Lauren, can you go ahead and tell us about your project, please?
Yeah, hi, I'm Lauren. I'm the Team 10 RN. You can continue on to the next slide. So I'm going to talk to you today about a process improvement that we're trialing in regards to visiting veterans inpatient and our ambulatory care sensitive condition readmission rates. So our goal is, one, we want to improve hospital readmission rates for our ambulatory care sensitive conditions. You might be wondering what the heck is that? I've listed them there for you. There's 7 of them. The 4 that we're focusing on first are heart failure, COPD, diabetes, and pneumonia. These are the top 4 readmission rates that we found for the Dole VA. So that's what we want to focus on first. Secondly, we want to provide a standardized education for ambulatory care sensitive conditions, no matter where you're at in the VA. So if you're inpatient or you're outpatient, we want to provide you with the same education so it doesn't get confusing. You can go on to the next slide. Why are we doing this? First off, admissions to the hospital can cause emotional and physical impact on veterans and their family. It can increase stress, which in turn causes further health issues. Readmissions are also shown to increase mortality rate, which obviously we don't want that. And then secondly, the cost of a readmission to the patient and the facility is expensive. Last year alone, 2020, Medicare alone paid $17 billion in claims for ambulatory care sensitive conditions. On average, the cost of a readmission is about $15,000. So we definitely want to bring that down so that we can take that money and put it to use in other areas of the VA to help our veterans. Go ahead and go on to the next slide. How are we going to do this? Well, there's several different things that we're trialing here. Some of them we've already done for some time. The first thing that we're trialing is a primary care nurse is going to the hospital side while you're inpatient and starting that education early so that you can review the education while you're there and ask your inpatient nurse any questions that you may have. Right now, I'm the only nurse doing this, and I'm only visiting for CHF, COPD, diabetes, and pneumonia. With that being said, if you're not a Team 10 patient and you do want this information because you find yourself inpatient, please let your inpatient nurse know. They know about this project and they can reach out to me and I'd be happy to bring that information to you. I just don't get to see a list of everybody that's admitted to the hospital. So I don't get to see that unless you're on Team 10. The second way we're going to do this is we're doing ER follow-up calls. If you go to the emergency room, you should expect a follow-up call within 7 days of being discharged. We just want to follow up with you, see how you're doing, see if there's anything that we can do to help. We might ask you to come in for a follow-up visit with the nurse just to check blood pressure or whatever we might need to. The third thing is we're doing hospital follow-up calls. We've been doing this for many years now, but your nurse should be calling you within 48 hours of you being discharged from the hospital just to make sure that you got your medications, see if you need any refills, if you got home and realized that you needed extra support in the home. Those are things that we want to catch early so that we can make sure that you've got the best care to help after your hospital stay. Fourth, all of our primary care nurses have schedules just like the doctors do. So you can schedule with your team RN. These slots would be for like education on your disease process. If you want to know more about your disease process, ways that you can help yourself, talk about stress you might be having, you need an ear wash. Those are things that we can see you for in our RN clinics. And I just want you to remember that RNs cannot diagnose and we cannot prescribe medications. We can bring you in for a nurse visit and do an assessment and then talk to the provider so that we can get you taken care of more quickly. But there are things that we wouldn't be able to do for you that the provider can. But we always encourage you to reach out, talk to your nurse, and if a nurse appointment is appropriate, we'll definitely bring you in to get you that care. And then lastly, we have new patient action plans for COPD, CHF, and diabetes. You can go on to the next slide. This is an example of an action plan. All 3 of them look similar, but they go over different symptoms. I encourage you, if you have one of these diagnosis, to reach out to your team nurse and they can fill this out for you. And I encourage you to also put it on your fridge for easy access. You'll see that it has a green, yellow, red. You can, if you're having symptoms, you can go to this, locate where your symptom is, and know what to do. On the back of that paper, it also will list your medication, and this is geared towards your health so that you have easy access to know what medications we're using to treat your condition. Next page. Next slide. Yeah. This one is the COPD. It looks the same. Next slide. This one is the diabetes, same general concept. And next slide. So lastly, we've already seen doing this project that we've seen a reduction in readmission rates within the first quarter. So that's encouraging. And then we also had a veteran who was discharged from the hospital. He was given a COPD action plan. He was able to identify his symptoms on that action plan, realized he needed to go to the emergency room. He was able to get treatment in the emergency room and not have to be admitted to the hospital. So, I mean, that's just a testament to what these can do for you. So if you have any questions, I'm going to stay online and I'll answer those later, but definitely reach out to primary care if you are interested in more education on this. And that is all I have.
Thanks, Lauren. A great pilot project. Looks like we have good results coming from it already. Just hoping that we can get that spread throughout the facility. So thanks again. Things are always happening here in terms of construction. Nick Howard, our Chief of Capital Projects, is here to show some of the different projects happening around Dole VA at this point. Nick? If you're talking, you're muted.
Thank you, Gene. The first slide we're looking at here, you'll see a picture which is a rendering of one of the dining spaces that'll be in our newly constructed community living center, part of Building 60. That project is pending some funds to get awarded for construction. Hopefully we'll see that soon. Our medical surgical space, which was our 3 East wing of our Building 1, is working through a contract modification for construction, and we'll hopefully have that space opened in about a year. Our Building 26 dental, police, and specialty care area that is currently under construction in Building 26 will be finished next summer. Our endoscopy project, which will add new spaces for our upper and lower scopes and our IT professionals and our biomedical professionals, will be out for award and should be awarded next month. And our Building 3 project, which will increase the pharmacy and redesign the parking out front, is pending construction funding and is currently slated for our FY26 project. Next slide, please. What you see on the left side of the screen is the internal layout of our boiler plant. As you can tell, there's a lot going on there, and it is working our way into completion this summer. The next 2 projects on the list are also infrastructure projects, chilled water plant and emergency power plant. Both of those are in design and should be finished this time next year. Our Building 4 project is under construction with completion late this summer. And our women's health space will be finished next month. And then we have a couple biomedical equipment projects that are working through design and will be starting construction this summer, our gamma camera and fluoroscopy. We are also getting ready to activate the space in Building 61 for MAS and in eligibility and enrollment. So you'll be seeing more information coming out on that very soon, and we are working through a new design for our fire alarm infrastructure that will be finished this summer. Next slide, please. And then we had a couple new starts this year. We are renovating restrooms in Building 61 and the lactation space at the facility that is working its way into design. And then we have 2 more projects for biomedical equipment. Our cath lab equipment It is working its way into design as well, along with our digital radiology equipment. And as Mr. Payne mentioned earlier during the presentation today, we are constructing a gravel lot out on the southwest corner of the facility. That lot will be complete in the next couple weeks. That will open up some opportunities for staff parking and open space closer to the facility for veteran patient parking and visitors. If you have any questions, please reach out. Thank you, Gene.
Thanks, Nick. And just so everybody knows, we're running slightly tight on time today. So I texted Nick and asked him if he had an opportunity to speed through it. And the man is a miracle at talking about all of the construction projects here, and he did it in 4 minutes. So thanks, Nick. Appreciate it. We've had discussions before about the My HealtheVet program, but we've got some additional changes that we need to discuss with you today. Jesse Colmy, the telehealth coordinator, is here to discuss those changes with you. Jesse?
Thank you, Gene. Good afternoon, everybody. Next slide, please. So as many of you may know, the VA has transitioned to a multi-factor authentication for logging into va.gov and My HealtheVet. It requires a login.gov or id.me credential to sign in. A few things that you'll need if you've not already created one is a driver's license, email address, and a phone number to get started. I definitely encourage everybody to go to their My HealtheVet. The system will prompt you to create a login.gov or id.me if you have not done so already, and just kind of go through the questions there. We also have step-by-step instructions if any further guidance is needed on that. So let us know. Slide, please. And now that you've signed into your My HealtheVet with your new login.gov or id.me credential, you'll have access to secure messaging, which is a great feature that's offered by My HealtheVet. Something that I personally use quite often. Allows you to send any kind of message to your healthcare team for medications or appointment questions, general medical questions. Any non-urgent, non-emergency type questions can be sent through secure messaging. It's a great way to contact your providers. And if it's something that you have not used before, I encourage you to log into My HealtheVet and send your healthcare team just a test message, just to say hi and get a feel for how to use it. It's a great option. Next slide. And just for everybody's awareness, the My HealtheVet office here at the Dole has moved. We are now located in room 124B in building 61. That is right next to the director's suite, if you know where that is. So stop by and come say hi to us. We're always here to help. If anybody needs any assistance with their login.gov or id.me credential, give us a call. We can set up an appointment or stop by. Make sure you bring that mobile phone, social security number, driver's license, and have that email address ready, and we should be able to get you taken care of. Slide. And then I just have some additional My HealtheVet resources for anybody that is interested. And that's all I had. Thanks, Gene.
Thank you, Jesse. Appreciate that information. And again, they did move offices just within the last week and a half. So building 61, room 124B. So thanks again, Jesse. Lastly, but definitely not least, is a program which probably isn't something available for those of you on this call, but you might have a kid, a grandkid, or a neighbor who might be interested. Brad Gifford, our acting chief of volunteer services, is here to discuss the youth program. Brad?
Hey, thank you, sir. Yeah, so we are very excited to announce this program. The Summer Youth Volunteer Program has been great in the years past. It teaches kids, customer service skills, and if they're interested in certain departments, then it really helps getting some knowledge in those departments as well. So some of the details of the program: you have to be 14 to 18 years old. You have to have a parent or guardian sign a slip or give a permission slip. And we accept applications up until May 23rd. Qualified applicants will be contacted to schedule an interview. So we'll interview those people. And then if they're selected, then the orientation will be held on Wednesday, May 28th at 9 o'clock, or Friday, the 30th at 1 o'clock. And the orientation lasts approximately 2 hours. The program runs from the 2nd of June to the 7th of August. And then at the end of the program, we usually have a big celebration, like a pizza party or something for the students. Next slide, please. Some of the highlights that you can pass along to the youth is, it's a great chance to give back to our nation's heroes. It gives them opportunities to explore career options, like I discussed. And it gives them a chance to gain experience, knowledge, and skills within certain departments. And of course, they always make new friends. Some of them are lifelong, I've heard in the past. And the program's a great opportunity to, if they're trying to apply for scholarships or anything like that, it's a good bullet on their resume for those scholarships. And just real quickly, I just want to put in for the regular volunteer program we have. Anybody can volunteer for us. It's more important now than ever because of some positions we've lost and stuff like that. So please come help us out. We really count on our volunteers. It's the first impression is the last impression. And that's what makes the quality care for our veterans so remarkable here. But thank you, Gene.
Thank you, Brad. Appreciate it. I'm hearing myself. This brings us to the question and answer portion of the program. As far as I can tell, Jeff, I believe we've covered all of the questions in the chat. I do
think we've got them all, yes. I would recommend that Andre contact transportation directly if he has some issues with any travel claim he may have filed.
Okay, thanks for that. And then we would open it up to questions. If anyone in the audience has a question and would like to unmute themselves, you can either raise your hand or just go ahead and unmute and ask the question. Not seeing hands or hearing anything. I think we're going to go ahead and finish up here. The recording of this meeting will be posted to the Dole VA website. And at the bottom of that page, it'll either be there later today or tomorrow. Again, thanks for joining us today. We look forward to seeing you again at our next town hall. Thanks a lot.